Thanks for joining us. I do have one correction. It's the regional lead coordinator, and the right call him the regional lead coordinator is why I think I get a lot of emails and questions about things that have nothing to do with lead, such as um, I've gotten questions about the you know, emissions coming out of the stacks and also like proposed pipelines, that type of thing. So anyway, we're here to talk about lead. Uh, as a background, my degree is in ocean engineering. Even though now I'm an environmental engineer, I did start working at the Philadelphia Naval Shipyard when that was open in 1984 as a naval architect. And then I worked in the environmental section down there as well. And then came up to EPA 92. I've been doing lead since 2006. And so that's what I'm still doing now. And that'll be till I retire. So let's get started with the first slide, please. Okay, so I'm going to talk mostly about, I'm going to talk about EPA and the different laws that we use as far as lead. I'm not going to talk at all about lead itself. Just be aware that there are various sources that how lead could get into your home. And so that they would be a concern. It would be chipping paint if your house is older than 1978. You would also have, in the old days, we had lead in the gasoline, and they stopped that in 75 and phased it in, and they can still find areas next to major highways like 95 where the lead is still in the soil from that time period. So you can get it there. People can bring it from home or from their work into their home. The other issue we run into is if it's an older home and you have the original windows, they've probably been painted, or doors probably been painted with lead paint at some point during the history. And so every time you open or close the door or the windows, the paint's going to leave some, we call them, I'm drawing a blank on that, friction surfaces. I got it. And that causes a little bit of dust. And then, if you got you're opening the windows because it's warm outside or you want to get some fresh air in the house, you open it up, a little bit of dust on the sill, and then the wind blows in the soil, in the lead, it ends up on the ground, on the floor. And where are the children, the young ones that are like the toddlers and such? They're on the ground crawling along, and they're going and taking whatever they find and put in their mouth. Those of you that are parents will understand that. So now I'll talk about lead regulations. There, in 1996, Congress decided we needed to take actions to stop lead poisoning in the homes. So the first one they started with was lead abatement, which lead abatement is the permanent removal of lead from the house, or some way of encapsulating it. I'm sorry, I'm drawing some blanks. So if you have lead in, say, on the baseboards, if they come out and take the lead, take the baseboards out, that is actually considered lead abatement. And that's just a small example. In our region, all of our states have been authorized by EPA to run the lead abatement programs. So we have very little in EPA, we have very little interaction with people about lead abatement. The next law that came out was we call it Section 1018 of the Residential Lead-Based Paint Hazard Reduction Act of 1992. We call it, and it's the lead disclosure rule, and we call it 1018. So what that means is when you're going to be renting a house, whether you're going to be the tenant or the the actual owner or landlord, there are certain requirements that you need to explain to the tenant or potential tenant as to whether there's lead in the house, and that's if you know that there would be lead. I'm not going to go any deeper into that. There's also a pamphlet that they hand out that has to be able to. Oh yeah, thanks for forwarding that for me. I forgot. So here you go. Went in effect in 1996. Target housing. It's a residence or child occupied facility before 78. So it's a residence or child occupied facility, and it would be for children under 6. So schools that have kindergartens would be considered child occupied facilities, and also child care where it's the same children that are there regularly. But it doesn't affect any type of commercial type buildings. Here we go. So it's when you're buying or selling a house. So let's talk about the rent, and then I'll get into RRP, which is the other law. I'll get into that in a few minutes. So if you can go to the next slide, please. So this is for the lead-based paint disclosure rule. And remember, I said it was 1018. So the basic requirements, you have to have a lead warning statement. The seller or landlord, I have a typo there, must provide knowledge of if there's lead in the property. Now, just because the house was built before 78 doesn't mean they have knowledge. It's whether somebody has come out and actually taken a test, they either did a lead paint inspection or a risk assessment of the property. The buyer or the tenant must also receive a pamphlet, and that'll be on the next slide. And then if there's an agent used for yeah, okay, that's good. So there's where the pamphlet, the sellers, and there's also an example of the, if you look, it's kind of hard to see it, but that's one of the disclosure forms. The difference between renting and selling or buying, when you're buying or selling a property, you get a 10-day period of time right after you sign the contract that you can have the house tested for lead. And so there's a waiver in there. If you don't want to do that, there's an area where you check the waiver. So that's lead disclosure in a nutshell. And if you're ever interested in, like, you want to see what the pamphlet looks like, it gives good tips on how to clean your house without making a mess. Like if you have old paint in the house, you don't want to be sweeping with a broom or something, because all you're doing is stirring up dust, that type of thing. Let's go to the next slide, please. And I see I have like a minute left. I was slowing it down. Okay, so the renovation, repair, and painting rule started in April 2010. I've been involved with it since 2014. Target housing, again, residence or child occupied facility before 1978. And there's thresholds that have to be met in order for it to actually be applied to the property it's being worked on. So the minimum threshold is you have to have greater than or equal to 6 square feet per room for interior work. So if you're having 4 feet in one room and 2 feet in another room, that doesn't count as 6. You have to have all 6 in one room. Then on exterior work, it's got greater than or equal to 20 square feet for exterior work. And it could be 2 here, 10 there. That's not the same type. It's just if they're doing 20 square feet on the exterior, that's going to make it. So I'm trying to point to my screen. Renovate right pamphlet. That's one of the ones that you're supposed. Let's go to the next slide because that's on there. There we go. So RRP requirements. The firm that's performing the work must be EPA certified. The firm has to have an RRP certified renovator, which means they've gone and taken an 8-hour course on the proper way to use lead safe work practices. Prior to the start of the work, they have to provide the Renovate Right pamphlet, which we just saw, and they have to keep a signed receipt for it for 3 years. The firm has to follow lead safe work practices and document that they followed lead safe work practices. And the firm must completely clean the area, verify and document that the property was lead free. Now, my only caveat there that I did not include was when they're going to do work in the home, they either have to test the areas that are going to be disturbed, in which case there's an approved kit that they can use that you can buy at the big box home hardware lumber stores, and or they can assume that lead is present in the home, and then that kicks in the lead safe work practices. And I think I have one more slide yet, there we go. So as far as enforcement, we enforce both the 1018 and RRP. And what we'll do is we'll go out if we get a tip or we randomly select some of a company or a landlord, and we'll go out and do inspections. And depending on the severity of the issue, there may be penalties as far as money or for the violations. And then also EPA can suspend or revoke or modify a firm's certification if there's an issue there. So with that, my portion's done. I'm not going to turn it, and I thank you for listening. I was a little choppy there. I'm going to turn it over to Hannah Bartling, who's one of my coworkers, and she's going to talk about the LLAP guide, which is the local lead action plan that the region's developed. And thank you very much.
Thanks, Kyle. It can be a little bit of a tongue twister. Hi, everybody. My name is Hannah Bartling. I'm a life scientist at EPA Region 3. Like Kyle said, I work in the same branch as Kyle. We work in the lead-based paint program, where I coordinate some lead outreach and education and special projects like this local lead action plan guide that I'm going to talk about today. So we can go to the next slide. So I want to start with talking about EPA's strategy to reduce lead exposures and disparities in U.S. communities, also known as EPA's lead strategy, to advance EPA's work to protect the public from lead with an emphasis on high-risk communities. So the tool that I'm going to be talking about today, EPA's LLAP guide, is included in the lead strategy goal 2, identify communities with high lead exposures and improve their health outcomes. Focus on creating a blueprint for identifying high lead exposure risk locations. So after identifying these hotspots, the LLAP guide can serve as a tool to address the lead issues in a community. You can go to the next slide. So before we talk about what the guide exactly is, I kind of wanted to paint a picture of the situations that we encounter when we're working to address lead. So when we think about how to characterize a situation involving lead, there's usually a few components. The first is that the situation is local. The lead-related problems facing a community are experienced at a local level with very direct impacts to the public. So even within the same state, the unique lead issues one city or a community might be dealing with could be very different from a situation in, say, a neighboring city or community. The situation is also multimedia. Because of the widespread use of lead, the lead sources impacting a local area are usually across at least a few different media, such as paint in homes, which we just talked about, lead in soil, lead contamination at a brownfield or Superfund site, or lead in water at schools. There can also be issues related to other aspects of lead, so maybe a lack of blood lead testing. And the situation is also cumulative. Lead is a legacy contaminant, and many people have been working on addressing lead for a very long time. Local areas can be at very different stages in their efforts to address lead, ranging from some who may have very strong local programs, laws, or infrastructure, and then some local areas that maybe have never worked on lead at all. So here at EPA, we have regional lead coordinators, which Kyle is our regional lead coordinator for Region 3. And then we also have a lot of other programs and divisions that work on different pieces of lead. But to really make impactful change in a community, lead needs to be addressed holistically to meet specific needs for a local area. So how can we do that? How can we really package all this information, provide structure, and then move forward to address things? Go to the next slide. So that's where the Local Lead Action Plan Guide, or LLAP guide, comes in. It was designed to address this situation. We call it a new guide for an old problem. It's designed to assist local government officials in identifying lead issues in their local area. So that could be a city, a town, a community, a county, and then move forward with designing a sustainable local lead action plan to address those issues. So the guide features 3 steps, which I will go into further detail on. Step 1 is to complete the interactive LLAP guide checklist. The guide features 3 checklists to gather data and then assess the current lead issues and get a more holistic understanding of local lead issues and some potential solutions. Step 2, officials can fill in and customize the LLAP template. And this is where they create their local lead action plan based on the concerns and goals that they identified in the checklist in step 1. And step 3, although implementation is beyond the scope of this guide, because it's really dependent on a local area's unique needs, the guide has resources and assistance that may be beneficial throughout the implementation process. Go to the next slide. So I want to review a few benefits of the LLAP guide. First of all, it's designed to address lead at a local level. It allows officials to assess their specific local area. It's customizable. It's intended to be unique to each community. So it helps them ask the right questions for their specific area. It's voluntary. It's not a requirement by EPA. It's not a commitment to EPA. And there's no need to report to EPA about it. So it's also sustainable. It's designed to be run completely independently and really empower local communities, local officials. But if local officials are looking for more support, they have the opportunity to get connected to their RLCs, their regional lead coordinators for assistance. They're linked on the web pages. It's comprehensive. It addresses lead holistically across multiple different medias. And it's also collaborative. So while local officials create the plan, depending on what activities they identify in their plan, they're presented with resources from a variety of local, state, and federal partners. And that could allow them to build connections and utilize existing resources and programs. So in the next slide, I have a pre-recorded demo of the interactive LLAP website.
The Local Lead Action Plan Guide, or LLAP Guide, is an online voluntary resource available on EPA's website for local government officials to identify lead issues in their local area and develop a sustainable targeted action plan using the LLAP template. Step-by-step instructions to using the guide are available on the main webpage. The recommended first step is to complete the 3 LLAP Guide checklists, designed to help local government officials gain a better understanding of local lead issues and potential solutions. The second step is to create a local lead action plan using the customizable LLAP template. The third step is to access a repository of resources that may be beneficial to local government officials throughout the implementation process. Officials that may have additional questions or would like further guidance or assistance with their plans and implementation are advised to reach out to their respective EPA regional lead contact. Given that officials may have very different levels of knowledge about lead and may know only very little or are not even aware about lead in some of the other media, prior to designing a local lead action plan, local officials may find it helpful to gather data and assess the current lead issues. 3 checklists are designed to encourage officials to get a more holistic understanding of local lead issues and potential solutions. And for best results, the checklist should be completed in order. Completed checklists will capture the answers to prompting questions about local lead data and history, current lead issues, and opportunities to address lead. Each checklist is recommended to download in Adobe Acrobat for best user experience. Local government officials can fill out their information, such as name, local area, and email in the boxes provided. Users will read each individual question. For example, the first question asks, are there reports or data on blood lead levels of the population in your area? And check yes if they know of reports or data, and then have the availability to type in their notes. Or if they're unsure, officials can click on the no or question mark, and both boxes will prompt resources to pop up in the resources box to point to additional information. Users can then copy the resource URLs and visit the corresponding web pages. Checklist 1 looks to assess local lead history and data, so collecting background information on lead in the local area, and features questions on lead exposure and lead poisoning, past local initiatives to address lead, lead in all different media, including soil, in homes, in the air, lead in child-occupied facilities, different cultural practices, occupations or hobbies that may cause lead exposure, and other pertinent background information. Each checklist has a bottom section for officials to briefly summarize their findings and outline specific concerns and goals. Any lead concerns identified can become goals to achieve, and any gaps identified can become potential opportunities and activities in the local lead action plan. The checklist can then be saved, and users will move on to checklist 2. Checklist 2 helps officials identify potential lead issues in their local area, prompting users to evaluate potential lead issues that are happening now based on any background knowledge or current observations, and evaluate questions about testing or available data indicating potential issues in homes and schools built before 1978, different various structures, in children's blood, in various medias, in any products or hobbies, any lead contaminated sites, land, or structures, any new lead hazards from renovations or demos, in drinking water from emissions. And users will then once again summarize their findings and note specific concerns and goals. They can then save the checklist and move on to checklist 3. Checklist 3 helps officials identify opportunities to address lead issues in their local area and is the most comprehensive checklist of the 3. It looks to prompt officials to consider a broad list of potential opportunities that they may have not considered previously. Questions include addressing lead in a local area's guiding documents or plans, specific opportunities to monitor childhood lead poisoning, including programs to fund free blood lead level testing for children, or programs to investigate lead in a child's environment if they are found to have an elevated blood lead level. Different already established programs like CHIP or Medicaid, evaluating local entities that may have programs already addressing lead-related issues, potential federal, state, or local funding streams, if training is available for those in lead-related professions, specifying if a respective state, tribe, or territory is EPA authorized to administer its own RRP program or lead abatement program. Do pre-1978 schools integrate lead safety into their operations? even if the local area has a lead ordinance or local lead law. And any additional entities that were not previously described, if they have any interest in reducing or eliminating lead exposure. And then the summary section, the concerns and goals, and save the checklist. Once all 3 checklists have been completed, officials can then access the local lead action plan template to begin developing their own local lead action plan. This resource is also recommended to download in Adobe Acrobat for best user experience. Users begin by filling out their information, capturing features like a mission statement to describe the plan's vision, and the main 3 to 5 concerns identified by the previous checklist. Officials can then copy and paste their concerns and goals identified in the completed checklist in these interactive boxes, and write in additional concerns or goals that may have not been included before. The template prompts officials to fill in short-term goals of 6 months to 2 years and long-term goals of 2 to 5 years, and then the priority actions that can be taken to achieve these short and long-term goals. Details include estimated time frame needed for the action, the current status, critical steps to accomplish the action, the target demographic, and potential partners who can help, as well as any other relevant information. Officials have the space to fill in 3 priority actions using this template, but can add additional actions by filling out another blank template. Users can then fill in future steps to ensure sustainability of their plan. So how it will be implemented, when they will meet with partners and stakeholders, and how they will monitor progress, and when they will make revisions. Throughout the development of their local lead action plan and after completing their plan, local officials can find both the implementation and strategies for success pages as resources for support. Although implementation is beyond the scope of this guide and really becomes dependent on the local area's unique needs, the implementation page contains best practices and valuable resources to support officials throughout the process. These resources include potential funding opportunities, educational materials, federal lead reports, different informational videos, online tools including EPA's EJ screen, listservs, websites, and resources for additional questions or concerns. The LLAP guide remains a living document, and resources on all checklists and the implementation pages will be continually updated or edited based on the best available resources. The last page on the LLAP guide is the Strategies for Success page that contains best practices and potential strategies for local government officials to develop their local lead action plans. This page contains 2 case studies from cities in the Mid-Atlantic region, Lynchburg, Virginia, and Reading, Pennsylvania, that successfully developed and implemented their local lead action plans. It also features their lead action plans that were formatted using the current local lead action plan template. For example, if we click on Reading, Pennsylvania, we can read through the inception of how the city started their plan, what unique priority actions the Reading team identified, including building local capacity and garnering public support to create a sustainable lead program. This page also contains narrative for LLAP strategies, such as using your local lead action plan as a starting point, remaining flexible and open to opportunities, raising awareness and engaging partners and stakeholders throughout different training and outreach opportunities, mapping lead presence to find areas within your community that may be more vulnerable to lead, and exploring many additional opportunities like updating existing or developing new local laws or ordinances, providing or receiving technical assistance and education on lead, and forming additional collaborations, partnerships, and coalitions.
All right, nothing better than listening to your own voice while you're sitting on a live presentation. So I think we finished a little bit early. And before we move into the Q&A, I just kind of wanted to throw in some additional information about how Lynchburg, Virginia and Reading, Pennsylvania kind of developed their plans. I don't have a slide for this, but just because we have enough time, I kind of wanted to talk a little bit more about, what their plans included and how they approach developing their lead action plans. Like Lynchburg, Virginia, the city already had certain policies and procedures in place to address lead in drinking water. They had the old infrastructure and a lack of inventory of lead service lines. So they had previously dealt with that. But they also wanted to explore, lead-related grants and funding opportunities. Both Lynchburg and Reading wanted to apply for a HUD lead hazard reduction grant. So for Lynchburg, we met with them. We helped share ideas of outreach, how to maybe create a lead ordinance. And then they were really focused on lead mapping. So they created a map of the city with lead related data. And then they wanted to figure out how to target priority areas to focus lead exposure prevention efforts. And then Reading, the team was actually the Reading Area Water Authority and an individual from the NAACP. So they identified, they had few resources. They really didn't have a lot of outreach. And they had unique issues in their area where they had not previously addressed, that they had majority non-English speaking population. So both Lynchburg and Reading had attended our Mid-Atlantic Lead Forum here in Region 3. And Reading really wanted to create a similar lead forum back in their city. So they included, like a legislative briefing, an overview of lead and water, maybe a community perspective, and then a presentation from the Reading lead program. So they really wanted to focus on conducting lead outreach, garnering that public support, getting grant funding, additional training, different things like that. And both cities are continually revising and updating their plans. They, 1 year out, they're continuing to have quarterly meetings with us here in EPA and internally within their own groups. So we continue to share information that we receive, say from HUD about when certain grants may become available, any webinars or info sessions about the grants, different things like that. So this slide has both Kyle and my contact information. And I think we're going to move into the Q&A session now. If anybody had any questions, if you wanted to write them in the chat.
If anybody has an issue with like somebody's come in and done renovation, repair, painting work in your home and didn't follow the RRP rules as far as were they laying down plastic, that type of thing, you can report a tip or a complaint at www.epa.gov/tips. And I'll type that in here right now. It goes into a database. It goes into a national database, then they go through it and forward it to us. It'll go to the enforcement section. We aren't actually in the enforcement section anymore. So, so there's the thing you can use to report a tip. If you just have questions, there's a hotline, which I don't have, but if you go to epa.gov/lead, that will get you a lot of the information we talked about already, and it also gets you the access to the books and pamphlets, that type of thing.
It does look like there's one question in the chat. I think this one might be for you, Kyle. It's asking, how do you modify a company's certification?
Okay, so I'm going to assume that it's a certification as a firm for RRP. So hopefully the person that's asking this will understand what I'm gonna tell them. When you applied for company firm certification, you would have gone to the CDX program, CDX online, and you need to, you can go in there, should be able to modify it in there as an amendment. If that doesn't work, send me an email and I can put, because headquarters actually takes care of the company certifications, but if you send me an email, I can get the person at headquarters to be able to help you out there. So there's another one.
Yeah. Did you want me to read it out loud?
Well, I'm looking at it and we only work, Hannah and myself only work on lead-based paint in the homes and such. So I have no information or even any understanding of that as far as the lead and on synthetic turf. So I apologize for that.
Yeah, and the website that Kyle put in here, epa.gov/lead, has a full repository of all information related to lead, not just lead-based paint. It also includes, you know, lead, air pollution, lead in drinking water. There's a lot of information on EPA's website. Yeah, I saw Carolyn just said that could be something that could be identified in the guide. Yeah, there's definitely possibilities for future revisions, and we've kind of been anticipating that, you know, as we're rolling out this local lead action plan guide, we're not going to have all information that's possible about lead. So definitely something that could be included in one of the checklists.
And while we're talking about adding to the checklist, another thing I get a lot of questions about are outdoor lead or outdoor shooting facilities.
Mm-hmm.
And EPA doesn't have any rules concerning those, but we do have a best practices guide on how to deal with them and outside. I occasionally get questions about them on the inside as well, because you've got the gun companies that usually have a place, but when I worked at the shipyard, we had in the basement of the Marine barracks, there was an old shooting facility under there, and you could still find the bullets. I mean, the paint was peeling and that was lead paint, but there was still lead from the bullets playing all around in it too. If we were on radio, we'd be in trouble with all the silence.
Yeah, I think we were supposed to go to 1:45, so I think it would be okay if we ended a few minutes early and then just moved into part 2 of the session.
But thank you, everybody, for listening.
Oh, we do have one question.
Oh, well, I'm seeing, yeah, it's a RCRA thing. You're right.
So in the chat, someone noted about shooting ranges. We do have regulations, but it is complicated. But once the area is to be cleaned, it is fully regulated under RCRA.
Yes, thank you.
All right, thanks everybody. I'm going to pass it back to Malia to move on to part 2 of the session.
Great. Thank you so much, Hannah and Kyle. I will now turn it over to Erin Sullivan, who will facilitate the second part of the session.
Thank you so much. And it looks like our slides are loading. Thank you, everybody. And we'll now be moving into the second portion. We have a conversation about children's health and the still and present danger of lead. We have 2 really great speakers today, so I'm excited for this opportunity to share this information with you. So next slide, please. So my name is Erin Sullivan. I will be facilitating today's conversation. I am EPA Region 3's Children's Health and Healthy Schools Coordinator. And I work in the Office of Communities, Tribes, and Environmental Assessment. And I see we have Carol Ann on camera and Dave on camera. So I'd like you to also just unmute when you are ready to speak, but I'll just kick it off with just a couple opening remarks here and introduce our speakers. So first we have Dr. David Didden. Dr. Didden is a physician director of the West Virginia Office of Maternal, Child, and Family Health. Dave has been a clinician leader in the state public health system for the last 8 years, initially as a local health officer while working as a solo family physician in his hometown of Shepherdstown, West Virginia. For the last 3 years, he has worked full-time with the state health department, focusing primarily on the public health response to the overdose epidemic, as well as maternal child health. Over his 25 years in medicine, he has practiced in diverse settings that include camps for migrant and seasonal farm workers, prisons, free clinics, a rural health center in New Zealand, as well as on the streets and in the countryside, bringing health care to people without housing. He is currently a Bloomberg American Health Initiative Scholar pursuing his Master's of Public Health degree at Johns Hopkins University Bloomberg School of Public Health. And thank you for joining us, Dave.
Thanks so much for having me, Erin. Excited to be here.
Great, awesome. And next we have Carol Ann Gross-Davis, who serves as a senior scientist and epidemiologist in the Office of Community, Tribes, and Environmental Assessment here in EPA Region 3. Dr. Gross-Davis currently serves as a board member with the City of Philadelphia Health Department. Dr. Gross-Davis holds an affiliate appointment with Drexel University Dornsiff School of Public Health. She earned a PhD in epidemiology at Drexel University School of Public Health in 2014, received her MS from Drexel University College of Engineering in 2001, and a BS in biology from Cabrini College in 1991. Dr. Gross-Davis has worked at EPA Region 3 for the last 32 years, and current responsibilities include cumulative assessment in communities experiencing environmental justice concerns and social determinants of health. Thank you for joining us, Carol Ann.
Glad to be here. Thanks, Erin.
And next slide, please. Okay, so today during our conversation, we'll talk about a recent high-profile lead poisoning case that happened in West Virginia, some of the low blood lead testing rates that were found in children around this case, building partnerships with state and local providers in West Virginia to identify the barriers of testing, and using lessons learned as a community at the community level about risk messaging and prevention. And so as we very much know that lead is still very much an issue in the United States and worldwide, it can be found in all parts of our environment, including the air, the soil, the water, and even inside our homes. Much of our exposure comes from human activities, including the use of fossil fuels, including the past use of leaded gasoline, and the past use of lead-based paint in our homes, as we heard about in the previous presentations. Lead and lead compounds have been used in a wide variety of products found in and around our homes, including paint, ceramics, pipes and plumbing materials, solders, gasoline, batteries, ammunition, and even cosmetics. Today, we'll be talking about why it's important to test children for lead in situations when we are not aware of an issue and also when we know there is a known issue. Childhood lead poisoning is preventable, and addressing it as early as possible is key. Okay, so now we'll take down our slides for our conversation, and I will let you know that during this conversation, we're happy to take questions as they arise. So please feel free to type them into the chat. We'll take breaks for your questions, and I'll have my colleague Stephanie Branch help us with the Q&A. So let's go ahead and get started. So my first question is to Dave. So many of us are aware that lead is dangerous, but what specifically makes lead dangerous to children?
Sure. Specific dangers of lead to children. And before I make a few comments, I'm not a toxicologist. I'm a generalist. Did most of my work in primary care and pediatrics in particular. So if I'm sure there are folks on this call who know a lot more about the pathophysiology of lead poisoning than I do. So feel free to speak up or if you have questions, would love to hear from folks and make this more interactive. Yes, so lead, it doesn't biodegrade, right? It persists in the environment and it acts as a neurotoxin. It's really good at mimicking calcium and zinc in their ion form. And so what happens is lead will get into the neurons and it will disrupt the normal growth and development of the nervous system, particularly in children who are developing so rapidly. But because it can so easily bind to tissues and to proteins in the body, there's almost no organ system that isn't affected. And there's no, I'm sure as you all know, there's no safe level of lead in the human body. So, what we see, unfortunately, is that it affects children's development, their ability to pay attention. There is a very well documented inverse relationship between blood lead levels and IQ. And the research shows that these levels occur at a very low level of lead in a child's body. So, but there are also, there's anemia because lead gets into the synthesis of the protein called heme that carries our oxygen around. And so we can see an anemia or low red blood cell count in children with lead poisoning, their renal effects, cardiac effects. So I think of it as being almost like we are just partially covering our children's eyes and ears and ability to sense and integrate into their environments that inhibits their their intelligence. So it's a major issue, but it is challenging also because epidemiologically there's this sensitive period, right, when children are exposed to lead during that period of development. That's when it's particularly harmful, and those effects, are, while there's no safe lead for anyone at any age, those same effects do not occur later on in adults, and particularly after age 6.
Mm-hmm. Thank you for those points. So you mentioned all those, anemia and possibly, attention deficit disorders and whatnot. Can you actually see if someone is lead poisoned from, just from visually?
Right. Yeah. Like, is there a rash or like with Wilson's disease, you can see copper rings in the iris? No, for the vast majority of children with lead poisoning, it's asymptomatic. You can see, very common complaints, the attention that you recognized. I'm very concerned about children who have been diagnosed too quickly with ADHD when actually lead poisoning is the underlying cause of their inability to concentrate. There is also the screening. The effects on intelligence. And Erin, I have completely lost my train of thought.
No, I was just talking about any outward
signs. Sometimes abdominal pain, constipation, but again, these are conditions that folks may not even bring their kids to the doctor for. So that speaks to the importance of the screening.
Right, absolutely. Carolyn, do you have any quick comments on that before I move on to the next question?
I just think going back to your question about whether people have symptoms for it, I think because we have done, or we feel, right, from a public health, we've got rid of the lead paint, like we've done things, but we've kept low. The more research we found, we've really now, we used to have very hard, oh, it's okay, you're not above this level, you're good. We don't talk about lead like that anymore, and we haven't for at least a decade.
Yeah.
But, so I think that's really, we are seeing those effects at really lower, much lower levels than we would have thought 15 years ago. And so I think that is where, from the medical perspective and the research, we are really, there is no safe level of lead in children.
That's right.
Like there's just, and that's kind of where, I would guess if you see symptoms, we probably have the research that they were probably at fairly high levels. Right, to actually get those physical type symptoms. So yeah, it's I'm going to think, again, that the title of our conversation, right, the still in present danger, right, we have not solved this.
That's right. That's right. And I will put medical providers right out there as needing major education about the importance of lead screening. I just, when I did a fairly cursory look at lead poisoning levels. This is when I was in practice, and the age of housing stock in my community. I didn't emphasize this so much in my preventive health visits. So absolutely, I think that we have to get that point across to get more kids tested.
Right, and we will talk a little bit more about that, of course, because that's one of our main topics here. So who should be concerned about lead poisoning, right? So we know that there are highly, really big issues with children being lead poisoned, but is there any other populations that should be concerned?
Yeah, well, within children, we really try to get a screening test done at age 12 months, and again at 24 months. So really getting in those first 3 years to identify those kids so that we can do some mitigation in the home and really lower those exposure levels and lower those blood lead levels. But any child, particularly under the age of 6, Aaron, I think, is really our target group, and also pregnant people, because of the association and typically with environmental exposure. So Carol Ann, other thoughts on?
No, I think, that the emphasis on even, women of, childbearing age, right? Kind of, because again, there could be storing it, and just to be aware of and because when you're pregnant, you want to really be aware of your current exposures, right? If you're moving, you don't want to be doing the scraping of the door, like you don't want to be renovating. You want to make sure that you are taking those precautions of wet dusting and, or, real things that you are currently trying to reduce kind of your own exposure, because it is transplacental, right? So like if whatever the current exposure I would be getting while I'm pregnant is, we're sharing blood, right? And so I think that again is just, I'm hoping we'll eventually get to where, with mercury and fish, we did a great job that, your OBGYN does not know anything about they're not a toxicologist, but for some reason people were like, I can't eat tuna fish. And they don't, right? And so I think that's kind of where I'm hoping we can kind of get with that, lead awareness, that it's kind of up there with, I don't want to have mercury. I don't want to introduce toxins into my diet or my house or exposure.
Right. And those who are nursing as well, right? So we think about, we're going through, during pregnancy, right? We're renovating the nursery, we're getting everything perfect. And then you get it perfect. And then you're sitting down and nursing in that room, right? So you want to make sure that, all of your exposures have been limited because of, that clear pathway. Yeah. Thank you for those.
And also just one last thought, Aaron, is other places that our children spend their time, right? If it's in daycare, it maybe they don't think they're in an older house, but their child 3-year-old spends every afternoon at grandma's. So also looking at other potential exposures.
Right, absolutely. And in-home daycares, right? That's a huge thing that we don't always, know what the age of the housing is, or, maybe the licenses aren't what they are supposed to be. That's a big issue potentially. Okay, so Caroline, I'll move on to you. I did see we have a question in the chat, but I'll get to that in a moment. Caroline, I'll ask you, can you generally describe the work that EPA does around children and lead, just to give folks an idea of the EPA perspective?
I don't know everything about kind of our children's health program, as Erin is our children's health person here, leader in Region 3, but I have been working nationally with our groups across the agency on our lead action plan, our federal lead action plan that was developed in 2018, that was really trying to focus, again, reminding ourselves that there is no safe level of lead, and we have so many arms of the government like HUD and the CDC and EPA, and really trying to figure out how can we work together and identify those goals of kind of reducing exposure, because that is something that we do have control over, right? There are some things that we can actually do, and I think we started there, and I think it's become a priority in all the regions. You can see in the previous presentation that Region 3 was kind of the key partner in developing that local lead action guide of really trying to get the word out. But I think another thing that just came out, we've had a listening session again, is really focusing on also the disparities of kind of what's actually happened. This is not an equal, the average, blood lead level, again, is not what your child's blood lead has nothing to do, with your individual house or your own child's blood lead, what the national number is, because it is so local. And so that's kind of some of the things we've been trying to, and we'll talk about some of the partnerships where we can support, where we do have, statutes and connections, or finding gaps in funding to try to connect those dots. And so we really have been, again, trying to, because sometimes, new regulations aren't always going to fix it. And even right now, the only federal requirements we have for blood lead testing are for Medicaid and Medicare children, right? And so we don't have like it's not you don't violate the law, right? If you just happen to be, the average citizen in West Virginia and you don't get your child tested, like nobody's going to be knocking on your door and giving you a fine, right? So it really is much more the personal one-on-one, developing these relationships with your providers, kind of figure that out. Again, that's not EPA's lane. However, we do have a lane in helping with risk communication and outreach and, funding and those types of things that we're trying to support.
Absolutely. Yep. Thank you. And Dave, similar question. So, what do you at the Bureau, what's your role with children and lead?
Sure. Yeah. Well, my position is in maternal, child, and family health. And within that, we have the West Virginia Childhood Lead Poisoning Prevention Program, which really centers our resources, our surveillance system, our prevention efforts, primary prevention, our outreach. And so that's run through the Childhood Lead Poisoning Prevention Program. So my maternal child health office is also part of the Bureau of Public Health, and we also have an Office of Environmental Health there. And so childhood poisoning prevention folks and environmental health folks work really closely together when a child has been identified and the parents are willing to get an environmental lead assessment. We get a certified expert into the home to do a thorough assessment. And then they work together to link folks to proper resources and make sure they're getting follow-up testing as needed and so forth. So those are the main efforts. We also provided some education to our state legislature on updating our childhood lead poisoning prevention rule, which was done just last year.
Right, and we will talk a little bit more. Well, I guess we could talk about that now. I guess, did you want to talk about what that change in the legislation was?
Sure, yeah. So Title 64, Series 42, a legislative rule was updated last year and approved in April. And so we were just behind. West Virginia was just behind on updating the blood lead reference level from 10 micrograms per deciliter. At that time, it was 5. It dropped further to 3.5 as we were getting this legislative rule approved. So it still says 5. But the biggest change was going to a universal screening recommendation because of the poverty rates in West Virginia, because of the age of housing stock and general concerns for environmental exposure. The legislature decided that not just Medicaid and CHIP members would be recommended for screening at 12 and 24 months, but any child in West Virginia should get a blood lead screening test following those same Medicaid guidelines. So 12 months, again at 24 months, and for children who have not been tested prior to age 6, getting them tested as well. Yeah, so that's kind of what we've got. And Carolyn, I know there's stuff at the federal level you're able to speak on.
Yeah, I think I mentioned, at least off the top of my head, besides I think the new strategies to kind of focus on those disparities. And I think that's been, I think, a challenge, I think, for our federal partners from when we kind of, we're going away from everybody should, like, this has been a moving diagnostic policy, right?
Yeah.
Everybody should get tested everywhere. Then, oh no, only at risk. And oh no. And so like now it's kind of like, I don't think the federal partners are kind of the leaders on setting those policies for state and local health departments. And so, and I think exactly what you're saying, Dave, what you guys did was really, hopefully, what we're not able to do, right? Because it is now more like private practice responsibility and kind of the healthcare system, as opposed to EPA having centers where you're going to go and get your kid tested, right? So we've kind of changed that model from the federal side kind of about, almost a decade ago. And so unfortunately, some of that also means less funding, right, for some of these programs.
Right.
So there's been a lot of, I think, which is, I think, from a federal side, highlighting these federal lead action plans, making it a priority at our offices like we're doing right now, that we spend a lot of time with communities in West Virginia right now talking about lead. We have new lead and copper rule regulations coming out, so we are kind of filling that other parts where we're trying to, we're reviewing our air quality, national air standards for lead, because we're trying to say, hey, or if there's really no safe level, let's think about this again, right? Let's bring the science. It's a little slow for us, but we're out there. We're working on it.
Yep, absolutely. Getting there, right? So I'll pause now on my questions and ask Stephanie if you could help us with the chat questions. I think I saw 2 come in.
Can you hear me?
Yeah, absolutely.
Okay, great.
Thank you.
So the first question came in from Rebecca Resk. I'm hoping I'm pronouncing your name right. What are you finding to be the main reason for low participation rates in lead level testing of children? Access costs, fear of needles, privacy concerns?
Caroline, do you have some thoughts from your end?
From my end, I think there's a couple things, and maybe I don't know that any of the ones right there might be top of my list, right? We're trying to figure out, because we do have, point of care, finger testing that we could use, right? Which is not as scary as kind of a venous blood. But I really think that a lot of the challenges we have is that people don't really believe that lead is still an issue. And this is really kind of that, where Dave and I really came together this past year, is if people are not getting their kids tested and we're putting out all this material saying it's dangerous, and they're not taking actions to protect their children, or, then we're not saying this correctly, because they're not getting the point, because nobody's not getting their kid tested because they don't care about their kids, right? Like, so we're not communicating this risk in a way that's actually making people take those next steps. And I think one thing that Dave and I are really focused on, and he mentioned it in West Virginia, is how do we get these primary care physicians to have this be, number one, like, as, the same as all the vaccines that they're like, how do we not have, this has got to be up there at the top, and not the extra, only if the parent brings it up. Or, your house isn't that old. We don't have to worry about that.
Yeah.
But I think one thing that we're trying to do in West Virginia is to see, are there specific barriers that you mentioned, right? Are there, like, because if there is a barrier, like say the health systems don't have point of care testing, well, maybe that's something we need to figure out the fix to make sure everybody has that. Or they're not as educated, or kind of didn't think it was that big of a problem, because they typically don't have a lot of kids with really high levels. And maybe they're in their head, they're thinking, if it's not over 10, it's not, so I think there's a couple, we're trying to figure that out, I would say, in West Virginia. Would you agree, Dave?
I would, yeah, that I did just a quick search to see if there were any national survey data to answer this, and I didn't find any. Certainly trust comes to mind. In West Virginia, there seems to be, and I think this is true in other jurisdictions, there seems to be this association of the Department of Health and Human Resources, my overall department, with Child Protective Services. Like, we see the same thing in our home visiting programs for early childhood intervention, for prenatal care, where folks qualify for home visiting. They don't take advantage of it because they think everything is an opportunity for somebody to report them to DHHR. So trust is a big issue. We don't have any authority to force people to get environmental lead assessments, even if they do have their children identified as having lead poisoning. So the trust component is a huge issue, and the local partnerships is the only answer that I can come up with. Is that this has to be seen as intersectional. It has to be an issue that's closely linked to poverty, to systemic racism and other forms of unconscious bias, and that we've got to take kind of a coalition-based approach at the community level if we're going to increase some of these rates. I also, almost equally see, in addition to trust building, the need for providers to start to get it. We need a switch. We need a light bulb moment somehow in medical education. I was on a panel looking at revising some guidelines for medical providers who treat ADHD in children. Huge document, 200, 300 pages. And I brought up, the association between lead poisoning and symptoms of ADHD. And from a host of pediatric providers, I heard very little concern about lead. I think somebody said it's not really that big a problem in West Virginia. And I'm not ready to declare it as, a huge major problem, but I don't know, because the doctors aren't testing the kids.
Well, Dave, I think that you can't, this idea that it's okay, no evidence means not a problem.
Right.
It's
right,
no, like that's kind of where we are. And, and that's that, because nobody said anything. Because we haven't, we're not running around because we don't have the data. But that doesn't mean that no data, equals no problem.
That's right. Right. Yeah.
Yeah, absolutely. Go ahead.
Go ahead, Aaron. I was just going to say we have.
It's also, that goes back to my initial question about, like, can you see lead poisoning, right? So there's all these other little things, right? But if someone's coughing, sneezing, running a temp, we run them to the doctor, right? But we don't always see those acute symptoms with lead poisoning. So just wanted to pitch that in there. So
Yeah. And I'm just trying to think if there are any other barriers. We tried to make it as convenient as possible and still, receive low uptake. So there are many.
But,
Mhm.
and I think, Dave, we might talk about this a little later. We are specifically, thinking about kind of that messenger bias, very specific in West Virginia, but even thinking about kind of the way we talk about things, like, even the concept of when we say this, they think this, right? Like change, like, because we can't just be like, we're from the government and we're here to help you. If we say we want to come in and test your water, they're like, I don't want, that's government. I don't want government in my house. I don't want them to report my extra thing that I built in the back without a permit. Like they're thinking all this other stuff that is, so how we first even make that, and it most likely shouldn't be coming from the government, right? And that's kind of some of the strategies that we're trying to talk about. How do we get it from the neighbor, from the church, from somebody else that's not, that can kind of say, hey, are you concerned about lead? And if you're not, but didn't you get the letter from the water board that said there's lead? So can we talk about like stuff like that, right? That's kind of more on that level of trying to find out why people are not taking advantage.
And I know when we tend to study things, we tend to see them wherever we are. That certainly happened to me in med school and in pathology. But so I've been looking at social epidemiology lately and learning more about the effects of poverty. And I think if I could design an outreach program to increase blood lead testing levels, I would do it in partnership with some resource that helps lift people out of poverty, with something that says, here's something one household can do. And I don't necessarily know what that would be, but I know that these same families are not going to their well child checks unless they absolutely have to, right? They're not taking, they don't have a high uptake of vaccination rates until they have to for school. So so if we're just relying on these other resources, these other service providers in a community that themselves have poor uptake in in these communities, then we're not going to see a lot of movement.
Right, absolutely. Stephanie, can you read off the next
Yes,
question?
so you ready for the next questions from Sheldon Fishman? Could you speak about primary prevention of lead, such as banning converting grass playing fields to synthetic turf fields that contain lead and PFOAs instead of the state-of-art grass fields that do not need lead or PFOAs?
So I think we might have talked about that a little bit in the last one, and I'm going to say that is not, that's not my lane. So I know that some of the things that we are doing for primary prevention, again, like I had said, the lead and copper rule update to kind of get more information on where lead service lines are. But I think, that's, something that, I don't know how much of the, do we have enough data, right, to kind of do those primary preventions? But that definitely would not be the Office of Environmental Justice or my experience as an epidemiologist to answer that. So Dave,
Sure.
I'm not sure that
I mean, I think being able to bring lead into those conversations as appropriate when communities are discerning decisions like this, I think is a worthy goal, right? Because we want more people thinking about this. If I were stepping up a primary prevention effort, I would really focus on housing. I would focus on, making sure that not only are children and families and people who are childbearing age in stable housing, but that those houses are free from lead. that would be my main thrust initially.
Sounds good. Looks like no other questions at this time. So
And
I'm
just,
keeping an
just
eye.
real quick,
Oh,
Erin, I do want to
go ahead.
add, and I know that there, you know, from at least from the EPA agency, will continue to look, you know, for opportunities to where we can do primary prevention. And one thing is, you know, we're looking at, you know, small piston engine airplanes, right? So we are looking to kind of see, and we expect, you know, some findings to come out, I think this year, right, that could trigger some additional regulations for those planes. And again, near small communities that, you know, might live near the runway, right? So there's some real, you know, so I think there are opportunities that the federal government, you know, in our action plan is kind of saying, hey, we need to look for, you know, additional opportunities, again, because we have not solved this issue already.
Absolutely. Yeah, great point. Thank you for that. So I did want to keep an eye on the clock, but also talk a little bit about, you know, how the partnership between EPA, West Virginia started off, right? So Dave, if you could talk a little bit about the Clarksburg water issue, just, you know, briefly, and then the partnering and the strategies and how all that kind of kicked off.
Sure. Yeah. I got involved in the Clarksburg response, I guess about 6 or 7 months after the initial cases were identified. So in May of 2021, there were 3 kids from Clarksburg who were identified as having elevated lead levels. They were screened by their primary care doctors. And so those were reported to our childhood lead poisoning prevention program, and the households did have environmental lead assessments, and they found drinking water as one lead exposure. And then the Clarksburg Water Board did further testing and evaluation of lead in the system in July, and they found, oh gosh, I think at that point, maybe 50% of the connections. I would have to refresh my memory on that, but it was fairly widespread. So that's kind of how we got started. And then, Caroline, anything from the EPA perspective on origins in Clarksburg?
No, I think, you know, I think that's where once it was identified as a drinking water, you know, violation, I guess, under the lead and copper rule, that's kind of where EPA, you know, so that's kind of when EPA came in, not necessarily, and again, I wasn't in the beginning either, right? I was brought in after the identification of it, and then brought in really because I am the human subjects officer for Region 3 and an epidemiologist to try to figure out what does the blood lead data look like, trying to help my, you know, colleagues here that were not familiar with this type of data. Like, what does it mean? You know, and that's kind of how I got consulted even before now that I've been working on this straight for at least a year, I guess. But that's kind of how, from my perspective, and then I started to run kind of the communication group to really start to focus on, hey, we did the first round of all this outreach that was well intended and well planned, and we kind of scratched our head afterward and be like, you know, not quite sure that, you know, we just broke through all those barriers that we just mentioned already.
Yeah. And then I was brought in when we were starting to have multidisciplinary team meetings with the local health department. I was a local health officer, knew the Harrison County Health Department folks, and then we started to meet regularly and come up with some strategies.
Right. So lots of strategies, a lot of different techniques, I guess, to get children tested, right? We had those 3 very high known cases, and then, you know, knew about the water issue. So did children rush to get tested? Did you see really high testing rates?
No. The water board and the health department did a great job initially getting the word out and making testing available. The most impressive step I think they took was to just bring cases of bottled water and deliver them to households. and also include some messaging on there about testing. We did see an uptick then. I mean, and when I say testing rates, our baseline is probably around 25 to 30% based on some Medicaid claims analyses. And these got up, in Clarksburg in, to the 35 to 40 range, I think, of eligible children. So there was an initial push, and then it kind of hit a plateau. We didn't see much increase in testing until we started to offer incentives. So we partnered with the managed care organizations who have our Medicaid contracts, and we got them to offer some incentive gift cards and things like that. And we partnered with Repack the Backpack event before school started, and had a test blood lead analyzer right there, so we could just do the finger sticks. Yeah, we just continued to coordinate with EPA and
But Dave,
the other state agencies.
I think one thing that you just mentioned, which is kind of why, what we're still trying to do, right? Is to, to have this, messaging to come out and get your child tested when there's another thing that is helping that family feel right. That again, because yeah, it's a backpack, but for, that's money that they don't have to spend on buying a backpack, right? They can go, so I think, or with the WIC centers, right? We were, trying to do those pilots at the health department too, right? Because let's go where people are already coming to get other services, and maybe we can help do that. Because I think that is where, even from EPA, right, trying to, partner with you and local healthcare systems, like where can we find leverage? Do we have an idea and we just need a little bit of, can I buy the health department 5 analyzers and 1,000 tests? Like if I can do, like trying to figure out what we can do, because I think that is where, what we learned in Clarksburg is we tried these things and we got like a little, and then, but nothing, because kids are still getting born, right? Kids are still turning, 12 months old, but we're not seeing like that increase that we would expect with the amount of effort from multiple agencies. And I think that's where we want to find, when we're doing these, especially with the states, we want to have some measured things that we can say,
that's right.
We believe this is going to be a sustainable thing that can be used, as opposed to a huge effort to get an extra 5 kids and then it kind of goes away. It's great for those. I mean, not that it's not worth it, but like we're got to figure out a way to, because again, there's not that many bodies in your office, Dave. I'm sure that
that's right. To do
this work.
It's got to be, from multiple directions. I was just thinking about an existing incentive program that the Medicaid managed care organizations have to encourage parents to bring children in for routine visits. So there's no, blood draw or anything necessarily, and there's low uptake on that as well. So it's a complicated problem.
Absolutely. Looking at time again, I don't see any of the questions in the chat right now, but I did want to give you both the opportunity to kind of talk about, what's next. So we have about 5 minutes left, it looks like. So what's next? And, what are your plans to address childhood lead poisoning, increasing testing? Dave, I'll start with you if you want to have any final thoughts.
I've got three kind of buckets. One is a long-term economic development that's needed, and in one jurisdiction we're working on a center or a conference or something, brick and mortar, to celebrate Appalachian Black history. Just so happens that there are some heroic figures in Black history from West Virginia that are from this community. And so we're looking at, that long-term approach to, like, we're trying to bring jobs, we're trying to bring infrastructure development. So that's a longer term approach. From the medical providers, we're trying to do report cards that are specific to their testing rates and really do that outreach to get folks ordering and following through on more testing. And then I think something that should be done nationally is to link the requirements for anemia screening for the WIC program, Women, Infants, and Children Supplemental Nutrition Program. Since they're already getting blood tested at 12 and 24 months for anemia, I'd really like to see that as a national strategy, is to figure out how we can also incorporate lead screening into that.
Really, really great ideas. Carolyn, how about you? What's next?
Yeah,
for
and
EPA for you?
Yeah, it's I'm again I'm working with Dave as much as I can on all these things, because we both kind of agree that we need to do more, because this is preventative and these are lifelong impacts. And again, Erin is also a public health practitioner. Is if we can prevent this stuff from happening and these exposures. And it's hard to prevent them if, we want to be doing separate general, like, let's talk about prevent, like, regardless of testing, right? Because we want to reduce everybody's kind of exposure to lead. But we can't kind of build this in a fear of it's, that parents then don't want to know, right?
Right.
So this is kind of where this, having, as David would call, like, culturally sensitive, conversations and finding the specific partners that can have that conversation in a meaningful way, like we're trying to work with local leaders and a church pastor to host an event, because we just feel that us talk, even intentioned we are, the health departments have spent 8 hours on a Saturday and nobody shows up, and
Aaron, and Carolyn, sorry, but I did see that one of our community partners is on the call, Ms. Ramelia Hodges.
Yes.
And Ms. Hodges leads a group, Dunbar School Foundation, that had really stepped up for local vaccine and COVID-19 testing measures. And we've also worked with her group to get a plan together to do local outreach in Clarksburg. So Ms. Hodges, if you could just say hi real quick and tell us in 30 seconds about your work, that would be great. If she's able to unmute. I kind of invited her last minute. Well, I can make a plug. It's Dunbar School Foundation in Fairmont, West Virginia.
Yeah, and that was kind of one of the first ideas of that we were able to leverage some funding from a great partner, to kind of knowing that, hey, if communities, like, learning those lessons from COVID, right, that having somebody in the community talk to somebody in the community about an issue like, hey, there's lead in the drinking water in Clarksburg where we know there's an issue. Please don't forget to get your vaccine, and here's information about lead. Can I help you figure out where to get tested? How many kids do you, or, even if it's the grandparent, hey, have you talked to your, do you have any kids? Do they live in Clarksburg? Hey, have they gotten their kids tested?
Exactly. And
having that kind of conversation when they're already doing such great work.
DSF has community health workers that could do the testing in the field and also are capable of doing the follow-up confirmatory testing if needed. So that was a cool twist that maybe next year we can report back to.
Yes, we're excited because, again, having those skilled community members to have those skill sets to be able to do that, again, is also a heavy lift that most communities, don't necessarily have, Ramala there, from Dunbar School Foundation. So we're very fortunate.
Yep, absolutely. And I am looking at time and getting all the nudges to wrap us up here. As you can tell, we're extremely passionate about this work. And I wanted to thank Dave and Carol Ann for joining us. We could talk about this stuff forever. And we're really interested to hear from you. So if you want to pop the slides right up for a second here, we have some contact information. So please feel free to reach out to Carol Ann or me if you have any questions following this. And we're happy to pass any questions along to Dr. Didden as well, if you have any for him. And I just wanted to thank everyone for joining us today, and for Carolyn and Dave for your awesome insights. Dave dropped his in the chat. Thank you so much for
Yeah.
doing that. And I'll turn it over to Molly.